CPR for adults, a self-instructional program for nursing students. Welcome CPR. Click here. What is CPR? Cardiopulmonary resuscitation. Cardio, heart, pulmonary, lungs resuscitation. Resuscitate, revive. Pulmonary resuscitation. Your heart is a big, strong muscle that expands and contracts more than 60 times a minute. These are some things that might prevent oxygen from reaching the cells of your body. Choking, poisoning. Here are some things that might prevent oxygen from reaching the cells of your body. Drowning, electric shock. Here are some things that might prevent oxygen from reaching the cell of your body. Heart attack, ventricular fibrillation. So what's the CPR stand for? Stands for saving a life. Learn the skill. You should know that CPR is effective less than 30% of the time. Does that mean it is fulfilled? No way. The types of victims you will probably run into will most likely be on the high end of the probability scale. So even though there is a good chance of your efforts will fail, that a person has a 0% chance of do nothing. Now let's talk about CPR, is and how it works. Begin. CPR is made up of two parts: rescue breathing, chest compression. Rescue breathing. You exhale air from your lungs into a victim's lungs so they can absorb oxygen. This assumes that there is adequate oxygen in your exhale air. When you breathe into a victim's mouth and you have their nose closed, the air is forced into their lungs and you can see the chest rise. You have successfully gotten some amount of oxygen into their system. Rescue breathing. Chest compressions. You manually compress the heart by pressing down on the chest. When you let up on the chest, the heart expands. Okay? The hope is that by compressing and expanding the heart, the blood flows through it as designed. Remember, goal to buy a little time for an emergency rescue team to arrive and revive. Here are the steps in conducting CPR. Here are the steps in conducting CPR. Number 1 step, survey the scene. Number 1 step. Take time to answer this question. Is the scene safe? What happened? Are there any bystanders who can help? Identify yourself as trained CPR provider. Survey the scene again. Step 2 is make sure it is safe for you to help the person. Don't become a victim yourself by rushing to help someone without being sure you will be safe. Some examples of these are victims in contact with electrical wires, victims traffic, or victims in fire. Another steps. Number 2. Activate medical assistance and transport facility. Call first if one respondent finds an unresponsive adult known to be of cardiac emergencies. Bystanders should make the telephone call for help. Somebody will be asked to arrange for transfer facilities. Next. Step number 3. Do a primary survey. Check for responsiveness and check for airway. Check for breathing. Check for circulation. Step number 3 again. Check for responsiveness. Make sure that the person in CPR, the person conscious. Mga pataklaki. Iniwa pa yung gaong kaya ang lalo yung example. Tapos step number 3 to. Do a primary survey. If yes, a person is conscious, then they do not need CPR. They may need shocking help on first aid, but not CPR. Do primary survey again, and they appear to be unconscious. Tap their shoulder and shout at them, "Are you okay?" Steps number 3 pa rin. Carefully roll the person to lower back. Head, tilt, chin, lift on over. You do this by first opening the person airway to the victim head back by lifting the chin gently with one hand while pushing down on the forehead while other hand. Okay. Do a primary survey. Look, listen, and feel for 5 seconds to see if the chest is rising, for any sounds of breathing, for any air movements on your cheek by placing your ear next to the victim's mouth and nose facing the victim's chest. Step number 3 pa rin pala. Check for airway. Carefully roll the person. Do a primary survey. Step 3 pa rin. Check for breathing. Is the victim breathing? Tapos, do a primary survey pa rin. If there is breathing, no CPR needed. Keep the airway. Check if the air is required. Check for circulation. Check carotid pulse for adults and children, located both sides of the neck. If with pulse, no need for CPR. No pulse, proceed to CPR. It may seem like a lot of steps, but all the checking only takes place about 15 minutes at the most, and it makes you certain that cardiopulmonary resuscitation is really needed by this person. Now that you know that he or she needs CPR, you've got to actually do the CPR. Okay, CPR, adults, 8 years old and above. CPR. Rescue breathing is a technique of breathing air into a person's lungs to supply him or her with oxygen needed. After checking that the victim is not breathing, pitch nose close, take a normal breath. Cover victim's mouth with yours and blow out your breath until you see the chest rise. Give a second breath. Take about a second breath. If chest doesn't rise, open airways again. Then do chest compressions. Place the heel of one hand on the center of the chest, right between the nipples. Place the heel of your other hand on the top of the first hand. Look your elbows and position your shoulders directly above your hands. Press down on the chest with enough force to move the breastbone down about 4 inches. Compress the chest 30 times at a rate of about 100 times per minute, slightly faster than once every second. Long heart. After 30 compression, stop, open the airway, and provide the next 2 slow breaths. Then position your hands in the same spot as before and perform another 30 chest compression. Continue the cycle of 30 compression and 2 breaths until defibrillator becomes available, until other healthcare providers arrive. Compression ventilation ratio 30:2. 1 or 2 rescuers. Number of cycles per minute, 5 cycles. 1 or 2 rescuers. Counting for standardization purposes.